Hey, what's up, everyone? It's Dr. Glenn Vo, and I am back for another MB2 Owner Spotlight. I am super excited to have Dr. Colleen Mohn. Colleen, what's up?
Hey, Dr. Vo, how are you?
I am doing so great, and I'm so excited to have you on because, number one, you have a unique story on how you became an MB2 owner doctor. Before we do that, though, where is your practice at right now, and how long have you been working with MB2?
Yeah, so starting off here, I just want to say how excited I am to talk to you because I've been following Nifty Thrifty Dentists for a while now, ever since I graduated dental school. And
Oh
so it was
man.
really exciting for me to see that you're joining the MB2 family.
Oh
I
man,
just wanted to give you a big welcome.
oh well, thank you so much. Thank you so much.
Yeah,
And yeah, that's what I love about these owner spotlights because I get a chance to meet you guys and to hear your stories. And you have a pretty unique story. So let's start
yeah.
off with where's your practice out and how you got into MB2 dental, being an owner at MB2 dental.
Okay, so my practice is called Health Centered Dentistry, and it's located in Midland, Texas.
Okay.
So I actually started out 4 years ago as an associate with MB2. And then 2 years later, I partnered with them. So there was a great opportunity that came up with a retiring doctor who was looking to phase out. And I had the ability to join up and partner with MB2 with that office. So been an owner for a couple years now, and the best thing for me is that I saw how different their model was when
Mhm.
I was an associate and saw how doctor driven it was.
Yeah.
And so it was kind of a no-brainer for me when it was time for me to go out on my own and branch out, become an entrepreneur and run in the dental business. And they were right there alongside me. So I've been really fortunate in that aspect.
Well, and so I want to, that's why I was so excited to bring you on because, a lot of the MB2 owners, they decide to partner up, but a lot of people don't realize that there is a path to ownership, right? Of
Yes.
associates being able to kind of partner with MB2 and then become
Mhm.
an owner, like an owner doctor. So let me ask you this. You had classmates who, they did a startup, maybe they did an acquisition, and then you did it in a
Mhm.
different way. Seeing their kind of journey and then comparing yourselves, how much less stressful was it for you to get into
Yeah.
ownership this way?
It was much less stressful. I was still able to have a great work-life balance. And also for me, being a new owner, there's so many things about the business aspect that you don't realize you have to know. You have to know marketing, you have to know HR, you have to know how to run your IT effectively. So all of those things, I pretty much had the greatest minds in dental business who I could reach out to at a moment's notice about anything. And so really being able to have them help me transition into ownership, I think was huge. So,
Yes. Yes,
yeah.
absolutely, absolutely. And I'm going to bring up a topic here, and it's a topic that you and I, and probably 98% of America are sick and tired of hearing about that, and that is this whole COVID thing, right?
Yeah.
So obviously, we see everyone on social media. We have friends in dentistry, and we saw how. Gosh, there's so many things we had to do, all the different loans, all the different rules and regulations. But in MB2, we were kind of taken care of there. So Colleen, talk about how during that, during the pandemic, and we're still going through it, but during that, the whole craziness there, talk about how MB2 has helped and compare that to if you didn't have MB2 around, you had to do it yourself.
Yes. So I was already grateful to be a part of MB2,
Yeah.
but then when COVID hit, there was so much uncertainty for a lot of people. What was going to happen? What does the future hold? But I felt like MB2 gave me so much support that I wasn't as worried. We
Yeah.
would have meetings with all the partners and discuss what we were all doing in our offices to, keep our staff safe. PPE. But MB2, they kept a steady influx of PPE for me. So that
Yeah.
was something that I never had to worry about was, am I going to be able to protect myself and my team? So you have access to things like that as well. They also gave a lot of advice about compliance, systems we can put in place in order to make sure that we're running our business appropriately. So that was all really great, having them alongside me for the office management aspect of it. So I know you probably felt really pleased to be a
Oh
part of it.
yeah. Well, and it's just the fact that we had someone who were experts, right? And
Yeah.
I mean, look, you know, you can get into the Facebook groups and ask each other, "Hey, well, how do you do this loan?" Right? But at the end
Mhm.
of the day, we're a bunch of dentists trying to figure that out. But we actually in MB2 had these experts who that's their job, right? We have the legal team, we have people who are like MBAs who understand all that stuff in accounting. So that's such a great advantage. And for you know, a younger doc like yourself, and let's for those who are watching right now, I want you to let them know, how long have you been in practice for?
4 years total and two
4
as a
years, and you're a practice owner now. You're a practice owner after the second year, right?
yes.
Wow. And so that's such an amazing, so impressive, because you know you're really you know young in your career, but you were able to get into practice ownership. You're able to kind of partner with all of us here to do your practice. And obviously, you know, there's a lot that's changed in your personal life. You just got married, but you went, you know, all these things, and your practice, it's not stressing you out too much because you have all that support.
I do. And the great thing, like you mentioned, kind of the legal team and the finance team and all of that. I mean, I have everyone's cell phone numbers. I just call them up anytime
Yeah.
of day or night and they're there for me. Like I really don't know if I've ever heard of anyone being that available for you because they truly do care about your success and we're all in it together.
Now I
And
want to. Now I know you're very early in your career, and but I'm sure you have all these big plans and stuff. So what are some of your goals for not only the practice but
Mhm.
for yourself? What are your goals? Are you with MB2?
Yeah, so my goal right now, of course, was I did have the retiring doctor who was staying on with me during the transition period. And so he'll be phasing out here pretty soon in about 4 months. So I just want to keep his vision going as well. He and I aligned very much so on how we wanted to take care of our patients,
Hmm.
what type of treatment we wanted to provide. And so now I just really want to grow the practice even more. I want to provide more services to my patients, like in-house implants and surgery and things like that. And then hopefully at some point continue to grow my brand. As you heard, it's Health Centered Dentistry.
Yeah.
So we're very focused on overall health as well. And the oral systemic connections and things like that. So I think being a part of MB2 gives me those opportunities to really just continue to grow and continue. The sky's the limit pretty
Yeah.
much
Yeah.
as to what I can do.
And I love the fact that you brought that up, because so many people, whenever they ask about MB2, they're asking, well, my practice is like this, and my practice is like this, and my practice is not like yours. I'm not sure if I fit in there, but you have a unique philosophy there. And
Mhm.
so, for those who are not sure about their philosophy of their practice, why don't you address that? Like, I mean, MB2 works with so many different practices. You don't have to be a certain practice to join MB2.
And that's why I love them because there's no other model out there where you get to be a partnership and have the advantages of being a big group. You feel like some of those organizations are all cookie cutter. It's the same exact model. Every doctor you meet in MB2 has a unique office.
Yeah.
And that's what makes it so special to me.
I love it. And you know, with all the different doctors in there, you actually learn a little bit from everyone, right? Everyone has their different system and whatnot. And I can't wait to when, you know, we always have these owner meetings. Unfortunately, COVID kind of put a damper on that, but I look forward to this so I can kind of meet you in person and learn about your practice and maybe bring some of that to my practice. Now, for those who are watching right now and they're watching us and they're wondering, you know what, I'm kind of on the fence with MB2. I'm not sure if MB2 is for me. What do you say to those doctors who are wondering about MB2 and wondering if it's a good next step? What do you say to them?
Yeah, I would just say, look at what your goals are, especially like if you're like me and you're an associate and you're ready to take that next step, but you're kind of unsure what holds for the future, where is dentistry headed? There is a third way to practice. So this is kind of a hybrid model. You
Hmm.
don't have to choose, being on an island alone in private practice. You don't have to choose going into a corporate. You can go this third way, as I was saying, and move into ownership and continue to have work-life balance and continue to have streamlined processes and just be part of equity in your practice. And so you can get benefits there for private equity and whatnot, which I know you and Dr. V have discussed in previous videos. So,
There's
really
something for everybody in
there is.
MB2.
Yep.
Yeah. And I love that because, it doesn't matter where you are in your career. We've had some other doctors who've been practicing for over 20 years. They were on the member spotlight. And I was really excited to have Colleen on here because she's young in her career. But that just means that she figured it out way sooner, right? She's the smart one, guys, just to let you know. She's the smart one. She figured it out really early in her career. But on that note, before we log off here, what else would you like to add for the people who are watching right now? And what is your message to them? Any advice at all?
Yeah, my advice would be really just think about what are your goals? What are you looking for? Really just as an associate, especially if you're ready to take the leap, know that you can have someone alongside you who will support you and take your goals and want you to be successful and help you right along the way. So I think that anyone who's listening to my story, if that resonates with you and that's something that you want to do, feel free to reach out to me or any of the other doctors. We're here for you, and we will be completely transparent about our experience and share our story. So
Awesome.
we're all here.
Well, Colleen, thank you so much. Guys, thanks for tuning in. This is Dr. Colleen Mohn, who is one of the MB2 doctors here. Like I said, reach out to her if you have any questions. Reach out to any of us. Thanks for tuning in, and be on the lookout for other owner spotlights and to hear their story. So we'll see you guys next time. Bye, everyone.
Thanks, Dr. Vo.